name is Dr. Joshua Taylor. I'm a general surgeon. I'd like to thank you for coming to see me today in consultation. I'd like to use this time using this video to explain the reason you're here to see me and answer some questions so that when you and I sit down, we can have a more in-depth conversation about what it is that is exactly going on with you or any questions or concerns that you might have. Inguinal hernias are one of the more common reasons that I see folks for a hernia. In general, this usually occurs over the course of your life because of repetitive stress or straining. The area where an inguinal hernia begins is naturally weakened, especially for men. There's a connection to the testicle called the spermatic cord, and that travels through the muscle layers of the abdominal wall, and where it enters creates a natural weak point. And so you may have developed a hernia there because of repetitive stress or lifting or straining, and that has allowed the hernia to develop. So common symptoms that you might experience from a groin hernia is noting either pain in your lower abdomen or pain that extends towards your testicle or your vagina. You may also notice a bulge, and you may be able to push that bulge back in, especially when you're lying flat. You may also experience an increase in pain when you exercise or walk. Some people also feel discomfort into their thigh. Occasionally, in situations, a portion of the bladder or the colon may be caught in the hernia, and so you may have some difficulty with urinating or having bowel movements. So when you have a hernia, oftentimes you need surgery to repair the hernia. For whatever reason, our bodies do not fix hernias, and so surgery is the only way that we have found to repair a hernia. Oftentimes, I perform hernia surgery via minimally invasive surgery, so either laparoscopic or robotic. And that just means that there are less incisions and smaller incisions than doing it the traditional or old-fashioned way of creating a larger open incision to fix the hernia. When we fix hernias, we go into the muscle layer and we close the hole in the muscle layer. Any of those contents from inside that we're pushing out, we want to get back in their correct position before we close the hernia. One of the most common questions that I get asked is, will I be utilizing a mesh? And the answer in short is yes. In the majority of hernia surgery, we use mesh. The reason for that is that there have been very good studies that have shown when we just stitch the hole closed, we don't do anything to make the muscles any stronger. And so that hole can come back over time, and there's a very high chance that that will happen. And so a hernia mesh is used to strengthen the entire area. I like to use the concept of rebar being placed in concrete to make the entire thing stronger. And that's the function of mesh. If you watch TV, you oftentimes will see commercials about lawsuits associated with hernia mesh. And so the common issues that surround hernia mesh are, number one, there is a little bit of an increased risk of infection because oftentimes we use a permanent material. It's often made of plastic. And number two, you can have a complication from the mesh being, you may have a reaction, it may not function the way that it should be. What I tell everyone is that likelihood is very, very low. The mesh material that we have begun to use is much more resistant to infection. And if you compare the risk of using mesh versus the risk of having a redo hernia surgery, those risks of the mesh are much lower than potentially needing surgery again. For inguinal hernias, there are several things that we think about specifically. There are several nerves that run very close to where the hernias begin. And when we're fixing the hernia, we have to be very careful not to injure or damage those nerves, because that can result in pain or numbness in the area where we perform the surgery. The other concern is, especially for men, is the risk of infertility. The connection to the testicle is often associated with the hernia, and so we don't want to damage that connection, or you could experience some issues with that. I'll be in momentarily to talk with you and be more specific about what it is that's going on with you and how I think surgery might help. If you have any questions, feel free to write them down. You can re-watch this video, and you and I will go through them when we meet.